Good evening and welcome. Thank you all for joining us. I am Carrie Hill. I am Senior Director of School-Based Initiatives at GCAPP, Georgia Campaign for Adolescent Power and Potential. And again, thank you for joining us this evening. We really are grateful for our partnership with Georgia SEAL and HealthWorks. HealthWorks is the overall goal is to reduce COVID-19 health disparities and advance health equity by strengthening vaccine confidence and enhancing access to COVID vaccine booster uptake to diverse, medically accurate, medically underserved populations. And now I will pass it on to our moderator for this evening, GCAPP's Chief Operations Officer, Dr. Mike Armstrong. Dr. Mike?
Thank you, Carrie. I appreciate your introduction. I am honored today to serve as the moderator of this panel, and I'm excited to introduce you to our esteemed panelists. Before I do want to remind everyone what we're here to talk about. We will be hearing from our expert panels on how the pandemic has impacted the mental health of youth, how the youth-serving ecosystem has addressed mental health needs, what is being done to provide youth now to address their mental health, and we want to hear about what's been helpful, really, and then what do youth have to say is needed for the future in order to promote mental health moving forward beyond this pandemic. Now, it's my chance and my honor to introduce to our panelists. We have a mental health professional, we have youth serving professionals, and we have the experts themselves, the youth with us. So forgive me while I read this. On our panel is Amber Barnes-McElhaney. She is a social work practitioner with years of experience in youth development and mental wellness. She is the founder and CEO of Empower Her Company, a wellness company for women, and the director social emotional health and wellness at the Boys and Girls Club of Metro Atlanta. Her passion for holistic wellness drives her to provide education, resources, and assistance that aid in promoting a better quality of living for everyone. She lives by the motto, when a flower doesn't bloom, you fix the environment in which it grows, not the flower. Her life's mission is to help people and communities heal and thrive. And you've heard from our host, Dr. Carrie Hill. Carrie serves as the Senior Director of School-Based Initiatives for the Georgia Campaign for Adolescent Power and Potential, GCAPP. She has a deep commitment to improving adolescent health and reducing health disparities, and is demonstrated by more than 20 years of experience researching, developing, implementing, and evaluating adolescent health initiatives. Prior to GCAPP, Dr. Hill served as the Assistant Professor in the Department of Health Promotion and Physical Education at Cal State University. She also served as the Vice President, Director of Programs at the Center for Black Women's Wellness Incorporated. Alongside Dr. Hill is Christine Steinman, who is a graduate of Florida International University, where she began her career in nonprofit youth development. She has been in the field for more than 22 years. Her work has traversed direct program service, change management, and leadership. She's an advocate for youth and out-of-school time and a leader of the Alliance of Boys and Girls Clubs in Georgia. Christine works to achieve the mission of Boys and Girls Clubs by enabling youth to become caring, productive, and responsible adults. And I didn't say this clearly, but she is the director of the Georgia Alliance of Boys and Girls Clubs. Alongside Christine is Zaina Goldie Suarez. Zaina Suarez is 15-year-old, and she enjoys reading, watching TV, and color guard. She is the youngest of 4 children and has 3 dogs. So do I. Zaina dreams to travel to Jerusalem one day and walk the Via Dolorosa. And our final panelist is Gracelyn Warren. Gracelyn is also a youth member of GCAPP's Youth Advisory Council alongside Zaina. She's a 17-year-old student at Central High School who uses her past struggles with anorexia to break the stigma associated with mental health. Her passion is bounce back beautifully by finding their identity in Christ. She has created a foundation dedicated to people just like her struggling from anything from anxiety and depression to everyday stresses, called bouncebackbeautifully.com. She currently serves on the Carroll County Youth Mental Health Task Force, Georgia Campaign for Adolescent Power and Protection, Children's Healthcare of Atlanta Youth Advisory Board, and she started the Stronger Together and Never Defenseless, or STAND Club, at her high school. This is a platform in which she uses to spread mental health awareness amongst her peers, and her goal is to use her story to help others going through similar trials. So needless to say, we have quite an amazing panel that we will get to hear from today. Before we hear from them, I do want to set the stage for this pandemic, and that has led to an exacerbation of mental health amongst youth. So some of these statistics might be old news to you, but this is really the stage that I want our panelists to respond to. So we have all been made aware of all the COVID-19 statistics throughout the pandemic across every media channel. But to find specific statistics on youth is a little bit harder to find. You've got to dig a little deeper. But as of the end of October 2022, nearly 3 million cases of COVID-19 have been reported in our state, and over 39,000 deaths have occurred since March 2020. Of these cases and deaths, 10 to 17-year-olds represent a small, albeit significant portion of these overall numbers. As of the end of October 2022, over 204,000 cases of COVID-19 had been reported in Georgia for 10 to 17-year-olds. And 20 to 17-year-olds have died as a result of COVID-19. The statistics on vaccinations are similar. As of October 2022, 6.8 million Georgians have received at least one dose of the COVID-19 vaccine. Of this 6.8 million, only 725,240 individuals were aged between 10 to 19 years old, or relatively about 10.5% of all individuals who've had at least one dose of the vaccine. While adolescents represent a smaller proportion of infections and vaccinations when compared to all of Georgia's population, they have not escaped the harm and dangers to their mental well-being through the pandemic. The statistics on the mental health of young people were alarming before the pandemic and have not improved with the added stresses that have come along with COVID-19. According to the most recent data from in 2021, 37% of high schoolers reported they experienced poor mental health during the pandemic. 44% reported feeling persistently sad or hopeless during the past year. And more than half, or 55%, reported that they experienced emotional abuse by a parent or other adult in their home, including being sworn at, insulted, or put down as a student. 11% have experienced physical abuse by a parent or another adult in their home, including hitting, beating, kicking, or physically hurting, being physical. And more than a quarter, or 29% of youth, reported a parent or other adult in their home losing a job. In addition, over a third of students said that they experienced racism or during the pandemic. The highest levels were reported among Asian American students at 64%, and Black students and students of multiple races at 55%. Now, these statistics, while alarming, surprise to those who work with young people on a regular basis, but they do represent a call to action or a cry for help, depending on your perspective. It is critical that we who care for the health and well-being of young people understand the challenges facing them and do whatever we can to address them. Now, my first question is to Amber Bard-Smekalani. Amber, you are the Director of Social Emotional Health with the Boys and Girls Club of Metro Atlanta, as well as the founder and CEO of Empower Her Company. As a social worker who has worked in promoting the mental health and well-being of youth, do these statistics I just read off resonate with your experience during the pandemic? And how else have you seen the mental health of youth impacted or threatened by COVID-19?
Thank you, Dr. Michael. Good evening, everyone. First, I just want to pause The statistics that you read off, oh my gosh, it's one thing to see it and live it and experience it every day, but it's another thing to actually have to sit and listen to it. And so I'm just grateful for this space and this opportunity to really just lift up some of the concerns that we're seeing. But to answer your question, yes, absolutely. Within my role here at Boys and Girls Clubs of Metro Atlanta, the statistics that were just given does resonate greatly with what I've seen and what I've experienced here, particularly in two areas, one being the number of cases that we've seen, and obviously the effects that COVID has had on our youth. When Boys and Girls Club of Metro Atlanta first opened our doors back up, and this is during the time where we were doing contract tracing and we had to shut down anytime we had a positive case. A lot of those cases didn't, well, I'll say the reports from those cases, when those cases were reported, it wasn't so much from our youth, it was more from the adults, from our staff and from our volunteers. And so that statistic, as it shows us that adolescents represent a smaller portion of numbers of those that have the infection, it's consistent there. That's what we've seen in our building. And I will also add too, though, in my experience and even working directly at a site, there have been situations where if a young person was asymptomatic, a caregiver will still allow their young person to come to the club, and a lot of times would not report a positive case. And this could be for various reasons. We recognize the population that we serve and the demographics that we serve. A lot of our families are single parents, and some have to work 2 or 3 jobs, and they may not have the opportunity to take off, right? It doesn't necessarily make the decision right, but we understand that there are barriers there as to why that decision could have been made. So I do want to highlight that. The other part, as I mentioned earlier, was the effects that COVID had on the youth mental health in particular. And you said the data, and you're absolutely right. A lot of reports of anxiety, a lot of reports of depression, and this lack of motivation, this feeling of hopelessness. All of these things are behaviors, these symptoms are definitely concerning. And I know here at Boys and Girls Clubs of Metro Atlanta, we're doing all that we can to support them.
Thank you, Amber. Follow-up. I'm wondering how the stress upon the youth members' mental health might have been manifested in clubs. How did you observe it? How did your teammates see it come out?
Yeah, absolutely. Great question. Honestly, so for those that don't know, Boys and Girls Clubs of Metro Atlanta, we do aftercare programming. And so a lot of times we offer sports, non-traditional, traditional. We offer academic supports and programming. We do a lot of different things, character and leadership development programs, et cetera. And oftentimes when our young people are engaged in these spaces, the behaviors demonstrate itself. Or oftentimes, because we pride ourselves of having such close relationships with a lot of our youth, they would just be so open to just come up and tell us like, hey, this is what I'm battling, this is what I'm dealing with. And honestly, that has been personally my experience with some of the relationships that I have. I actually did a listening session not too long ago just to do an emotional mental health check-in, and they were just like, Miss Amber, I'm struggling. I feel like I have social anxiety. And I'm just like, oh man, that's a great term. Let's unpack that. What does that mean, right? And that's actually one of the things that I know statistically we didn't really cover, but a lot of our young people are reporting having social anxiety and not wanting to interact with people or their peers, feeling this overwhelmingness of pressure, right? And oftentimes the way that they cope through that is through technology. So oftentimes we see them behind their phones, but it's a coping mechanism for them. And so, as I mentioned before, how we've seen it show up is through regular conversation, or we'll see the behaviors in our programs.
I think that's so insightful, Amber. You touch on a point that I'm certain others who are listening might have heard, which is we don't know all the data. The data doesn't present the full picture. It's a great picture, but we know that there are other things that youth have struggled with, and you've named one through social anxiety. So thank you for acknowledging that. I also know that there was a lot of learning for everyone, both families, individuals, and organizations during the height of the pandemic before the vaccines were even available. I'm curious that once they were available, what role did the availability of vaccines for adolescents play and influence the mental well-being of youth that you're aware of?
It's a great question. And honestly, I feel like a better person that could answer it would be a youth, right? I imagine that if I were in their shoes, it would be similar to the experience of any other vaccine, right? Whether it's the flu vaccine or mandated vaccines that they have to go to school, right? A lot of times we don't consider the psyche or the mental state of how a young person may feel to have access or to be able to obtain vaccinations, right? Or medicine or whatever that is, right? But one thing that I will say is that for those that had access to the vaccine, that wanted the vaccine and was able to get the vaccine, we have seen in conversation I've experienced where there was a lot of stress relief. There was a lot of just feelings of I don't have to worry about COVID so much. That was more so of their experience. However, on the reverse of that, for those that maybe wanted a vaccine, but didn't have the access to a vaccine, or there was maybe some odds within the family dynamic where mom maybe wanted it, the child didn't want it, or vice versa, it could create stress, and that directly affects and impacts the mental health of a young person. Not to mention that part, you add social media and the pressures of social media and what we're learning through the CDC and through, the news and all of those things. And so it definitely has its pros and its cons. But I imagine that for those that wanted the vaccine and had access to it and was able to get it, it was very relieving for them and beneficial for them, as well as for those that maybe didn't want the vaccine, didn't have to get the vaccine, and so they don't have to worry about it. So I think there's just it varies depending on perspective. At least that's how I see it.
Thank you again, Amber. Before I go to my next question, I realized that I forgot to speak to our audience out there. I see a couple notes coming across my screen saying that the chat is disabled. You're right, the chat is disabled, but we still want to hear from you as you're listening and learning, as you have questions or insights you want to share. I do ask that all of our audience members use the Q&A function that you can find at the bottom of your Zoom screen. We are reviewing those questions, and when the time is right, we will pose them to the panelists and share your thoughts as well. So got that housekeeping out of the way. I apologize for not doing that up front, but it's behind me now. But I want us to keep moving forward, building off what Amber has shared with us now. My next question is for Christine Steinman. Ms. Steinman, in your role as the director of the Georgia Alliance of Boys and Girls Clubs, you have a high-level perspective on how Boys and Girls Clubs across the state serve young people. Can you share what the Boys and Girls Clubs across Georgia have been doing to address the mental health needs of youth in our state through the pandemic?
Yes, and I think Amber did a really great job. So I'm going to say thanks for introducing Boys and Girls Clubs so well. But Boys and Girls Clubs, she mentioned, they do out-of-school time programs. So we are open when schools are out. So after school, during the summer, during breaks, we are what most people would call a safe haven for clubs across the state of Georgia. We have more than 150 sites across the state of Georgia in more than 60 counties. 75% of our clubs are actually outside of the metropolitan area. So Amber's organization represents a good chunk of it. They represent about 25% of the clubs that are in Georgia. But to answer your question, Mike, we do a lot of different programs for our kids, and they fall in the areas of academic success, character and leadership, healthy lifestyles. But we've never in the past really done anything to address mental health, at least not directly on. Most of us are not licensed mental health care practitioners. We're not psychologists. We're not social workers. But in recent history, in the last 15 years, Boys and Girls Clubs have come to recognize the importance of mental health in our kids. It used to be the statistics, and I believe they're probably pretty still much in line with 2/3 of kids, 2 out of every 3 kids have experienced some type of trauma in their life. With the pandemic, it's probably pretty safe to say that almost all kids have experienced trauma in some way, shape, or form. It's impacted adults. I know Amber talked about social anxiety. I know I had anxiety during the pandemic prior to the vaccine being released. And it's very much a logical conclusion to come to say our kids were also impacted, especially if you had young children or teenagers who were, I'm looking at the teens on the screen, you can't tell where I'm looking, but especially if you had teens who were separated from their friends for an extended period of time. And social media became the only way they could connect. So it is something that Boys and Girls Club recognizes as important. Trauma was there prior to the pandemic. Trauma is there after the pandemic. The only consistent has been that. And so we have taken a very close look at our programs. We've taken a close look at our strategies, and we pivoted just a little bit to support our kids with non-clinical tools to support them. Our kids, the one thing that I would say Boys and Girls Club thrives on is building supportive and healthy relationships with our staff and with the adults in our building. Relationships are one of the most effective interventions in building a child's sense of safety, trust, community, and connection. If you are not with those adults, you don't have that. And during the pandemic, you lost it. So I would say that the one thing that Boys and Girls Clubs have done is we've pivoted, and we do this time and time again. We've done this in more than 150 years of our history. That's why Boys and Girls Clubs are still successful today, is we look at the needs of the community and we pivot to meet those. Currently, all of our Boys and Girls Clubs across the state are participating in a trauma-informed care training. And with that trauma-informed care, while we can recognize the signs of trauma, we can recognize the signs of child abuse. In the past, we haven't had the tools to really address it. And we're changing that now. So while we are increasing staff awareness and skills through staff development so that our staff can identify the signs and symptoms of youth in distress, we're developing youth social and emotional skills. We're building resiliency in kids by proactively seeking programs that are going to do that. So whether it's a Boys and Girls Club program or an evidence-based program, social emotional skill building helps our young people understand and express how they're feeling so that they can cope with any type of distressing or challenging experience that does come up in their life. A lot of times something happens in life and we're reactive to it. Our programs are built and centered around teaching our kids how to respond, to think before responding. So turning those thoughts and feelings into actions, identifying feelings, identifying what you're feeling, if it's anger, if it's happiness, if it's sadness. And that's something that a lot of the programs we're offering are doing now. The other thing we've done in the past, but we are taking a step further, is engaging and supporting families. So where I mentioned earlier, those supportive relationships are the most effective interventions. They can oftentimes be overlooked if you're not doing it with a family as well, because you don't want to support the kids in your programs and then turn around and they don't have that when they go home. So providing workshops for families and connecting them with those resources that they need so that they feel better equipped to support their kids. So where their kids may be learning things at the club that their parents may never have gone through, the parents may have their own trauma that they haven't actually addressed either. So we try to connect the dots for them and connect them with one another. That mutual trust and respect is foundational to supporting youth mental health needs. And so making sure the families feel supported, that they know where they can find those resources, that we have built a net of safety, emotional safety, and trust in those relationships we have with both our kids and our families. So they feel comfortable enough to come to us, say, I'm struggling, I need a referral to a therapist, or I need a referral to an organization that can better support our needs at this time. And then, of course, providing access to mental health services. I mentioned earlier, we are not licensed mental health care practitioners. We're very fortunate to have Amber in Metro Atlanta because she is a social worker, but it's not the case across the state. We may have some clubs who are fortunate enough where they have enough social workers where they can bring them into the club to support our kids. For those that don't have it, they partner with local agencies to bring in those services, to bring in those people to then connect with our families. Nationally, our national office, Boys and Girls Clubs of America, is also partnering with organizations to better support. So they're building an arsenal of mental health organizations where our kids and our families can access those services with either little to no charge and or free. One of the things I know that we are looking at, we're not quite there yet, is making sure that we have an opportunity to provide free online, not by us, but by a licensed professional, free online counseling for our teens, for our kids, for our families. So we are going to continue to work on that. But we do have a goal right now. We do have a funder who is sponsoring trainings for all of our clubs across the state to become trauma informed and trauma reactive, so that they know how to, or trauma responsive, I should say, so they know how to do it, how to react when a child is displaying signs of trauma or displaying issues with mental health, and what to do in that case and how to refer them. So a little bit of everything.
That is an impressive and comprehensive list, Christine. Thank you for sharing that, both from the non-clinical and the clinical side. And I don't know if our audience members know this, but if they're not, the Boys and Girls Clubs of Georgia is the largest out-of-school time provider in the state. But even with that, we know that not all youth in our state get to participate in Boys and Girls Clubs. We have to rely on partners in our state. We are part of a larger youth ecosystem that serves youth across our entire state. So with that, Christine, I'm curious, you mentioned partners, but what have your partners and Boys and Girls Club partners across the state in this ecosystem, what have they done to address mental health and well-being of youth?
I would say a lot of the organizations we partner with, and we partner with various types of organizations. We partner with local school districts. A lot of them have asked us to bring in some of our evidence-based programming into the school, where the schools meet the academic needs of our kids. They're not able to meet the rest of their needs. Kids need all kinds of things. Adults need all kinds of things. If we're being honest, adults could use some of these evidence-based programs as well. And so we partner with our local schools. They invite us into the classroom, and they'll provide us time during some of the elective hours to come in and actually run some of our evidence-based programs. But there are also other nonprofits who bring their groups to the club to participate in some of our programs, and vice versa. So where we may not have an arsenal of therapists ready and available, but we partner with our local mental health agencies in the community so that we know where to refer them to. I think the biggest thing that a lot of our youth serving partners are facing is a lack of training and awareness on how to support those needs. Because where out of school time programs have always filled that gap of, where do I send my kid when I'm working and they're out of school? I want them to be safe. I want them to be engaged in something positive. It can sometimes be difficult to fulfill all the needs that those kids may have. So I know we've partnered with Boy Scouts, with Girl Scouts, we've partnered with GCAPP. We have multiple partnerships like that across the state. I can't name every single one, there's too many, but I do know that we all participate in various meetings and talk about what are the things that our kids in this community need. And oftentimes we try to band together. So where one organization is lacking and may not have specific programs or specific opportunities and events, we look to our partners to fill those gaps. So taking a more holistic approach, or a more of a 2 or even 3-tiered approach to serving a family has been the most, I would say, fruitful and productive thing that agencies have done, where we've seen that one organization cannot do it all alone. Although we all love to say we're the best, right? But we can learn from one another, and we can partner and try to better serve our kids and our families and our communities by partnering. So coming out of the pandemic, I think we learned that we operate in silos a lot of time, and there are needs in the community that have to be met, and it can't be done alone. So going ahead and partnering with those other agencies has been critical to the success of what we do and building those networks and building those supportive relationships.
All right. Well, thank you, Christine. I've just checked the chat in the Q&A section, and I see a lot of positive affirmations and kudos, and I love those. And I want to thank folks for sharing them, bring them on. But I also want to remind the audience that if you have any burning questions that you want to hear about, please share them as well, and I will ask them when it's time. But before that, my next question is for Dr. Carrie Hill, our host for the evening. Dr. Hill, also as the Senior Director of School-Based Initiatives at GCAPP, I know that GCAPP, given as my organization as well, is an organization committed to improving the overall health and well-being in our state. And as a part of GCAPP is focused on youth empowerment. So Dr. Hill, what has your work in youth empowerment revealed about the health needs and desires of youth in Georgia?
Yeah, so we are so fortunate to work with over 70 young people across the state of Georgia who represent 27 counties. These are young people between the ages of 14 and 24, and we have Gracie and Zaina joining us today from our Youth Advisory Council. And this group serves as peer advocates. They are raising awareness on issues that they feel are most important. And as we were having discussions about issues to advocate for and raise awareness, mental health kept coming up. It kept coming up at the start of the pandemic and continues to be part of the discussion on issues that our young people want to address.
Fantastic. How has GCAPP addressed the mental health needs of youth it reaches?
So I'll start with some of the things that are similar to what Christine was saying. So one was, training our staff. So making sure our staff is trained on trauma-informed care, certified for youth mental health first aid. And now we're able to provide that type of training for other organizations. So that was, awesome to be able to make sure that we are prepared to address the needs. Also resources for parents, like our free online parent toolkit, offering that type of support through our website. But I next want to pivot to the word fine. I recently heard someone say that fine stands for feelings inside not expressed. And I think that we're probably all guilty of saying, oh, I'm fine, at times when we're really not. And yes, it may not be appropriate for that particular setting or that particular audience for you to really just, share exactly how you feel. But I think it's important to have those safe spaces, right? So that's one of the things for us, is that we have been creating that safe space for our young people to express themselves. So early in 2021, we held a focus group because, again, we kept hearing about mental health being a topic that they wanted to address. So we wanted to learn more about that. When you say you want to address it, of course, we've been hosting webinars for the community, but what else would you like for us to do? And our Youth Advisory Council members formed a mental health group, because they said, listen, we want to address our own mental health issues and the issues of our peers. So they designed a program. They said, we would like to be able to meet regularly and, have activities like yoga, mindfulness, invite our peers to these activities. So, of course, nonprofit, we said, listen, we're going to have funding to be able to support this activity. So we applied for grants, and I'm really happy to report that we did secure funding to address those issues or those items that the young people said that they wanted to work on through mental health. So we're really excited about that. We've been hosting the yoga and mindfulness workshops, not just for our Youth Advisory Council members, but their parents as well. And soon their peers will be able to join them. So we're really excited about that. We also did Photo Voice. I'm not sure how familiar you all are with Photo Voice, but it's being able to tell your story through photos. And when we asked our young people what issue they wanted to share or what story they wanted to tell the story about the stress that they're experiencing and the mental health issues that they're experiencing. Maybe at some point later, I'll be able to show you some of those photos, but of all of the topics laid out there that they wanted to address, mental health was the one that they wanted to use for that Photo Voice project.
Thank you, Dr. Hill. You heard me earlier ask Amber about the role vaccinations have played in the mental health and well-being of youth. I'm curious, what role, if any, has GCAPP played in promoting COVID vaccinations amongst young people in the state of Georgia?
So as I mentioned before, with our young people raising awareness for health issues, COVID was one of the ones that they mentioned. And so we've been hosting several webinars. We've been hosting vaccine awareness or posting it on our social media platforms. So that's been a great opportunity. And also working with Morehouse School of Medicine, we've had a couple of young people who've been able to have surveys completed throughout the community. So again, that is something that we've been able to do based on them stating that they wanted to raise awareness.
Thank you, Dr. Hill. Now it's time for us to stop talking about young people and actually hear from some of the experts we have in our panel. My question now is for Zaina. Zaina, GCAPP's Youth Advisory Council serves as a platform for youth and young people in Georgia to raise awareness and educate the community on health issues that they feel are most important. Ms. Suarez, as a leader on GCAPP's Youth Advisory Council and as a young person in Georgia, I would love to get your perspective on youth mental health. We know that there are issues of concerns for youth that are unique to your age group. What particular stressors did young people encounter in 2020? And what stresses unique to your age group are you still facing now? What makes you sad? What makes you angry? What's made your peers anxious? Can you share about some of that?
Yes, sir. So a big stressor in 2020 was definitely isolation. Not only isolation from your friends and family, but isolation from things that you did every day, like going to the grocery store, going to the mall, going out to eat. It all just caused anxiety, and you didn't know what was coming next, which caused even more anxiety, which often led to mental health, like just bad mental health. And a lot of teenagers that didn't have any mental health issues beforehand started to develop like just sadness and just bad mental health in the process of isolation, honestly. And a lot of teenagers and youth just didn't know how to approach it. They didn't have the tools to help. And sometimes talking to someone wasn't even an option. And that is still something that is big today.
Gotcha. I want to flip that question on its end and ask you, what makes you happy? What are the things that improve your mental health?
What makes me happy is reading a book or spending time with my family, going to church. And I think that things that make me happy, like what I just stated, really improve my mental health. And I think that's for everyone. Like if you do something that you hate every day, your mental health is not going to be good. So I just want to say, like, do what you actually like to do. Like, don't do something because someone tells you to, because your mental health is not going to be the best that it can be.
Makes sense. Thank you for that. As we move closer and move beyond COVID-19, what can adults do to support youth and their mental health? We've heard a lot already from the professionals from the Boys and Girls of Georgia and from Metro Atlanta. But is there anything you think that you and your peers need or want that hasn't been addressed yet?
I think the biggest thing that adults can do is actually listen. I know that's like very broad, but if I tried to come to someone like an adult and they just brush me off and saying that I'm being over dramatic or that I'm being just, this isn't a real problem, I don't want to open up to anyone. And then my mental health or everybody's mental health is just going to be bottled up inside of you. And it's not going to be good. You're just going to get worse. And all I want to say is that adults should try to understand what teenagers are going through right now, especially since this is like, we're coming out of the pandemic. And I just think that adults and teenagers should try to work together so we can move past this.
I think that is a powerful comment, Zaina. Listening, not always easy to do, but so important. Thank you for sharing that. And if you got any tips for us who are on the panel or listening in about how to improve our listening skills, please share that with us towards the end here. But I want to hear from your colleague, Gracie. Gracie, you are also a member of GCAPP's Youth Advisory Council. I want to ask you the same questions I asked Zaina. As we move closer and move beyond COVID-19, what can adults do to support youth in their mental health that hasn't already been done?
So I think a big thing that comes along with just COVID in general and the mental health surrounding COVID especially is honesty. I know that it's hard a lot of times to hear your parents or hear adults around you talking about things like vaccines or the people affected by it. But a lot of times people overlook the youth who are also being affected by it and also have a say or have an opinion on things like vaccines. And so I think it's really important just to be honest and to be open and to listen to, just like Zaina said, listen to what we have to say, because yes, we don't know as much as those adults do in our lives. We also have an opinion, and I think it's important for us to feel like our opinions value, even though yes, we might not have the final say in whether or not we get this vaccine or whether or not we can go back out into the public and be move away from things like masks and things like that. I think it's important to consider that we also are affected by these things, and as much as we as students tend to try to look away from the negatives in life, things like COVID, I think it's important that you as adults encourage us to open up about those things that we probably are still also struggling with, but are afraid or feel like our opinions don't value. So I think it's important to listen and to be honest.
Very powerful again. And I think most adults would say that they do a good job listening, or they feel like they're honest. And what I'm hearing is that may not always be the case. But I want to hear more. What I'm an adult. What can I do to listen better? What would it take for you to feel as if someone like me or a teacher or another colleague or even your parents, what would it take to make you feel as if they're being honest and creating a space that you could share?
I think a lot of times when we do approach adults, or just friends that I have approach adults, or youth in general approach adults with things that they're struggling with, I think the initial response, even if a friend is coming to another youth, I think our initial response as humans is just to, you know what, I know exactly what you're going through, or I feel what you're going through, when really that's not what we might want to hear, because no, you don't know exactly what I'm going through. And I think it's important that you consider that and you say to them, you know, I don't know what you're going through, but I want you to know that I'm here for you. And I think that's really, really important, just to take that a step further, and rather than just saying, you know what, it's all going to get better, because, or saying, you know, I know exactly what you're going through. I went through this, which was similar. Yes, there is similarities, but at the same time, I think it feels more close, I guess you could say, or intimate when someone does say, you know, I don't know exactly what you're going through, because everybody's story is different, but I am here for you no matter what, and you can come to me, and while I might not have all the answers, I'm here to support you and encourage you. And I think that's important. Just, you know, that goes along with being honest, because we don't know exactly what other people are facing. In fact, a lot of times people are going through a lot more than they say, or even you can see in their lives. And I think it's important that we take that into consideration when we are having those conversations and trying to help others going through difficult mental health struggles.
Thank you, Gracie. I want to ask Zaina, I want to ask you a similar question. Can you tell us about a time when you felt like you were truly being heard by an adult? What was the environment? What was the experience, so that those of us listening could try to replicate that?
Yeah. Okay. Sorry, something popped up. I think a time where I was truly being listened by an adult was at my school. I approached my theology teacher, and I was just very overwhelmed by school because I missed a couple of days because I was sick. And I was just very overwhelmed, and I just thought I was never going to get through this. I was going to fail all my classes. It was a bit dramatic, but I went to her and I was like, I don't know what to do. I'm just not sure. Just help me, please. And we sat down and I felt like I was truly being listened because she didn't try to say, oh, well, someone has went through this and they've gotten through. She validated my emotions and she actually listened instead of just saying like, oh, okay, yeah. It was a conversation. I felt like I wasn't talking to a teacher, but I was talking to someone not on my level, but someone that I could relate to. And I think she did a very good job at like trying to comfort me while being realistic and telling me how to get it done.
Thank you, Zana. Thank you, Gracie. Now it's my turn to stop asking questions and hear from our audience. We've got a question here for Kristen, for Kristen and Amber. Christine and Amber. How have you seen the kids who have been to the Boys and Girls Clubs grow up? And do you see the same kids go to the Boys and Girls Clubs as they grow up with their kids?
I'm going to defer to Amber as a former club kid to answer that question.
Yes, so I actually attended the Boys and Girls Club back in 2000. The actual organization that I work for, my office is actually in the same building where when I was a kid. So I am proof that we come back. But honestly, I've been a part of the organization, working for the organization for over 6 years now. And every class that I've seen graduate, a good number of them always return, or they'll bring their children to sign them up. So, because my children actually are on the other side. So, honestly, we're a family. I don't know how else to put it. The Boys and Girls Clubs that are located throughout. I can only speak to Metro Atlanta because that's my experience. But the Boys and Girls Clubs that are throughout Metro Atlanta are in communities that truly need them most. And I know coming from a family where my mother was a single parent and we relied heavily on having just care, after school. I grew up here. I started when I was 12. At the time, we didn't have a teen center. We had the snack room. That was our teen center. And I went off to college. They helped to pay for my college. And I grew into who I am now because of them. And I felt that it was only right to do what was done for me. And so that's what brings me back. But to answer your question, we see generations come through the organization, and oftentimes they come back.
Thank you, Amber.
There's nothing that I can add to top that. She's a former club kid, so for me that's it. That's creme de la creme. But I will share that across the state it is similar. I started off working in the clubs in actually the Male and Dean Men's Club up in Canton, Georgia, and then have been through with the Boys and Girls Clubs for the last 20 years. And I have kids who have grown up and have kids of their own, and they bring their kids to the club now. So they do come back and they do have success. Now, are we successful with every single one? No, unfortunately, but we do see a great amount of our kids be successful, move on to do things. And it goes back to what Gracie and Zana were saying about having an adult there who listened. When kids talk about their club experience, it's usually not the programs that we offered. It's the adults that were there. They'll think back to that one person. Zana talked about that teacher, her theology teacher who just listened. They don't necessarily come to the club for programs. They come to the club for people. And I mentioned it earlier that one intervention that really truly helps someone is that supportive relationship with that adult, that trusted adult who will just sit and listen without judgment and hear what they're having to say. Youth voice is so important. That voice being heard and not being told how to feel or not being expected to change their feeling in that moment is so critical to helping someone through an issue. So crawl down into that hole with someone when they're feeling down and let them feel down. If they feel down, eventually we'll help pull them up. But in that moment, let just sit in the hole with them. Let them feel their feelings.
Thank you. That's a great segue to the next question here from one of our listeners. This is for everyone, but I think more specifically to Gracie and to Zana. The question is, how can we start open discussions about mental health between youth and adults? How do we do that?
I think a really good way to do that is just to have those open opportunities. A lot of times, with school being the way that it is, we can our ideas and our questions regarding things other than academics can be kind of pushed to the side sometimes. So I think it's important that we open up those times when, you know, teachers are willing to listen to those kinds of things, or family members for that matter. Like Miss Christine was saying, you know, relationships are a really big deal when it comes to mental health. And I know personally through my story, you know, I would not be where I am without the support and the relationships that I had during that. And so I think it's important just to have those spaces where you feel like it's non-judgment and you can say what you feel, and you can feel what you feel without being judged for that. And one of the ways I'll share that I know that's helpful in my school, and I've seen some benefits, is I started a mental health club in my school called Stand. And just by doing that, my goal for it was not to have Gracie's friend club. I wanted it to be diverse and to have those students who, you know, don't play a sport or aren't involved in some extracurricular. I want them to feel like they are involved and that there is a family of close-knit people that are there for them and whatever they're going through. And so by starting this club, it's been really cool just to see the amount of kids that have opened up. And it might not be sharing their personal story, but just sharing something, you know, hey, I struggle with anxiety. And then, you know, to see the chain reaction of, oh, you know what, I do too. And yes, it might be test anxiety for one person and separation anxiety for another. We share that thing in common, which opens a door to conversation and us being honest with each other. So I think it's just important that we have those times set aside where students feel like they can talk about things other than a sports team or academics.
Thank you, Gracie. Anyone else on the panel want to answer the question of how do we start open discussions about mental health?
And another thing I'll add, just while I was still on, I've kind of come to realize that you can't give help without somebody really wanting it. I think it's important that students come to you rather than you bombarding them, because, you know, I tell people all the time, you can't achieve recovery without being in the mindset of recovery. And so whether it is something small that you're going through, like separation anxiety, or something big like an eating disorder for me, until you accept that you are struggling, you're not ready for that one-on-one conversation about what you're struggling with. You know, it's important that you accept that first. And that's where I think the support comes in handy is, yes, you want to support someone as much as you can until they're willing to express what they're really, you know, to the point what they're struggling with. And from there, you can get them connected to those professionals who know exactly the path they need to take in order to get them the help that they need.
Thank you, Gracie. Okay, this question is for everyone. As we approach and move beyond COVID-19 and the pandemic, how have you seen youth change? How are they different now than when they were before the pandemic?
Hey, Mike, I can take that one. So as I mentioned earlier before, I've had the privilege and opportunity to work. Although I'm in leadership, I actually moved my office out of our support center and into a clubhouse so I can still be amongst the young people who I still dearly love. But I can tell you that prior to COVID, a lot of our young people were more open, they were more engaged, they were more outspoken, they were more just really like just taking the initiative. And I say all of this in perspective of like us doing programs. So a lot of our programs, we value youth voice, we value youth choice. And so that's how we've seen that come up. A lot of times they would tell us like, we want to do these things, we want to experience these types of things, we want to go here. Since the pandemic, since reintegrating back into our building, that initiative is gone. The motivation is not there as much. I actually was having a conversation with a colleague because I'm very observant, and sometimes I just find myself like in a room just wanting to feel the energy of the young people, and that social anxiety and that detachment and the separation is thick, and you can see it, and you can experience it while you're in the space with them, and it's very disheartening. I will say it's very disheartening. I will say that even the communication amongst peers has changed, and this is just something that I've picked up on and I've experienced personally, and this is throughout Boys and Girls Clubs of Metro Atlanta. I even have nieces and nephews that are experiencing the same thing, and they're not club kids, and so I just think that there's definitely been a difference behaviorally, especially um, from pre-COVID to post-COVID.
Thank you, Amber. I want to hear from the other panelists. How are young people different now than they were before, or are they not?
Yeah, I can piggyback on what Amber said. She mentioned the motivation not being there and how different things are now. I would say probably the biggest thing is when you think about the amount of time that kids were in quote unquote lockdown or in virtual school and away from the classrooms and away from their friends and their peers and their teachers and anyone outside of the home, we find that our kids are operating on a different development level than they were prior to the pandemic. So your fourth graders are responding to situations and issues like as though they were a second grader, for example. So the way that they deal with conflict or the way that they deal with stress or the way that they deal with academics even, we've noticed that there's a difference. So we're now having to talk to our fourth graders like we would our second graders. And a lot of that comes from just that lack of social interaction, that lack of peer-to-peer that they would have had they been in school, had they been in person. And where Boys and Girls Clubs during the pandemic were open, the schools were virtual, but we had kids come into the club using our Wi-Fi and they were there. They were still in a very virtual setting. So they might be sitting side by side, but they're not interacting with each other. They're listening to the facilitator, to the teacher on the screen. So we found that just having worked with them, that they are operating on very different levels, both emotionally, psychologically, than they were 4 or 5 years ago. Academically, we've all seen academically how far our kids are in their reading and in their math. And some of that is of the pandemic. Some of them were already behind previously. But trauma, the outcomes of trauma come in different ways. They can come in academic challenges, they can come in behavioral challenges, they can come in the form of psychological issues, they can come in very many different ways. And there is no one way to resolve all of it, but we find that in just changing our approach to how we're talking to the kids and meeting them where they are. I don't remember if it was Gracie or Zaina who mentioned earlier, is not everybody's willing or able, I think it was Gracie, to come and start talking. So we can offer them help, let them know that we're here, but not force them into it. So it's kind of a similar approach to working with kids who are operating on a different level than we would have expected them to at this point. So your sixth graders are like fourth graders, your eighth graders are like sixth. It's that 2-year difference. So I would say that's probably the biggest thing we've seen across the state that I've heard from a lot of our clubs is they're having to change how they approach and how they talk to the kids because the kids aren't there yet. They're not ready. So having to kind of scale it back a little and go back to how we did things before when they were younger to help catch them up. So I think it's just changing our viewpoint and our expectations. We need to change our expectations. We need to meet them where they are and then help bring them to where they need to be. But it's an expectation thing too, I think, for adults. So
Thank you, Christine. Thank you. Okay, panelists, you have all done a great job representing your own experiences and how you and other nonprofits have addressed the mental well-being of youth. But I want you to think about other entities like schools, government agencies, faith-based institutions. Are there activities or services you think they could offer that may support the mental health of youth in the state?
I don't want to feel like I'm talking a lot, but it's because I just finished. I would say that transforming organizational culture to be more responsive is critical for any agency. And I don't know if it comes from the government or if it comes from the clinical field, but transforming that organization to or that culture to be more human, one that is more focused on healing, one that is more focused on resilience building in our communities is probably the most needed thing at this time. So if we're talking about what can we get from our leaders in government or leaders in the school district, it's that culture change of moving to more of a resiliency focused approach as opposed to an expectation that people should just be there. I don't think we should ever expect people to just be there and ready to to deal with any trauma that comes at them, right? So I think changing that focus or that mentality is probably going to be one of the key things. And I don't know what the answer to that is, right? It's okay to say I don't know, but I would say that might be one of the most needed things that we would need from our leaders and in our government agencies.
Yeah, I really agree with that. I think a big thing is we already have a lot of the nonprofits and a lot of the resources that we need. It's just a fact of making those things known and making those people that are involved more adept and more responsive to mental health situations, because as awful as it sounds to say, mental health is getting bigger and realer as we speak. And so I think it's important just to get those people trained and get those people on the level that they need to be in order to respond to these mental health crises that are so common now.
Thank you, Gracie. Okay.
And hey, Mike, I'm
go ahead.
sorry.
Please go,
If I
Amber.
could just add this, this is like a adjunct to that. I'm an advocate and a believer that any practice that we practice starts at home, right? So I know we're talking about different entities, agencies, organizations, etc. All of those individuals are key. They're essential in helping us to move the mark, right? But honestly, the real difference makers are the families. What families do, what they practice, their young people will. They'll pick up on it. And so for those that are caregivers on here, for those that are parents on here, you want to help improve the mental health of young people, you improve your mental health. You show them what are best practices at home that we can do as a family unit, that we can all do, whether that's doing emotional check-ins before we go to work and before we go to school, doing mindful moments once a week, right? Let's go for a walk at the park and let's make that a practice. Or let's, whatever that looks like. And then yes, let's involve the community in helping us to support the practices that we already implement at home. I think oftentimes we rely so much outwardly when healing is done inwardly. And so I really believe that it starts at home with the support of entities within our community.
Thank you, Amber. I have one last charge and question for all of our panelists. And while you think about your answers, I'm going to do my best to sew up and summarize what I've heard this evening. So panelists, in just a moment, I'm going to ask you to share your 30-second call to action for the community. Does that make sense? Okay. Well, while you're thinking about your answer, what I heard this evening is that mental well-being and mental health is possible. There is hope, and not in the most complicated clinical manners of addressing mental health. It starts with relationships. It starts at home with the simple yet powerful practices of listening, acknowledging that you don't have all the answers, whether you are a young person or an adult. And that if we all start from that same place of understanding and wanting to heal, whether that's individually or a culture of an organization, that brings about the possibility of mental well-being I'm going to say it makes it more real and possible for all. Simple but powerful messages coming from each of you, and I thank you for that. And now I'm going to stop talking, and I'm going to ask you now. This is your platform. You have 30 seconds to call this community to action. What is your call? I'm going to start in random order because you're on my left-hand side. Amber, you're first.
I felt it coming. All right, y'all. I just ended with it starts with us. And that's what I want to leave with you. That in order for us to get this thing right, it starts with us and it trickles down to the people that are closest to us. We have to make sure that we have the resources. I love how Gracie said that the resources are there, the tools are there. Use them. We have to use them and not be afraid to use them and not be afraid to ask questions and really destigmatize what mental health is and change the narrative around it. We all have mental health. Some just needs to work on it more than others, and that's okay, right? And that's okay. And so I just really want to leave with you all that it's okay to work on self-care. It's okay to take a moment for yourself and get yourself together. It's okay to address your traumas and understand your triggers and figure out what practices work for you. So that way we can teach the generations beyond how to do these very things. And I think that's how we can definitely start to approach not only youth mental health, but the mental health of our world. Thank you.
Thank you, Amber. Dr. Hill, your turn.
So I'd like to go back to what Gracie and Zaina said about listening. So listening to understand and not to respond. Having conversations with our young people that validates their fears and validates their stress. And as Amber mentioned, self-care. I mean, so, it really making sure that we are taking the time to manage our stress, to work on self-care so that we're at our best for our young people.
All right. Thank you, Dr. Hill. Zaina, you've got the floor.
So I really want to go back to listening. So I think the adults in our lives, I hope I'm speaking on all youth, the adults in our lives just need to work with us and connect with us. We want them to listen to our needs and concerns and stand with us and try to help and try to come up with a solution so we can move forward. Thank you.
Thank you, Zaina. All right, Gracie, you're up.
Okay, I will just kind of go off what my bio in the beginning, but my call is just to break the shame that comes with mental health because everybody has mental health issues, just as Miss Christine said. Everybody's going through something, whether it be huge or small. We're all going to experience and have experienced mental health to some extent. And so my passion is really just to make people see that it's okay to not be okay and to be open and honest and willing to share what you're going through in order to get as much help as you can.
Thank you, Gracie. And last but not least, Christine, what is your call to action?
I'm going to go with a very deep and philosophical ditto to what everyone else here said. I think they've all done a really great job expressing what our call to action is. I think maybe the only thing that I can come back to and offer is that all of us need to be educated on our own traumas. Everyone talked about it. Removing the stigma too. I think a lot of times, especially, or at least in the communities we work with across Boys and Girls Clubs, there's a stigma with asking for help when it comes to mental health. There is an association with, oh, that's for crazy people, that's for this, that's for that. And that's a stigma that needs to go away. And that's been mentioned by everybody, I would say, on this on this Zoom today. But educating ourselves as a community as to what it means to have issues with mental health, to struggle with anxiety, to struggle with eating disorders, all of that is something that I think as a community, we all need to do a better job is educating ourselves, but also being willing to talk about them. Sometimes it's shameful to admit that there is something wrong. And so when you walk away from here today, I hope that each and every single person who has listened, who has called in, that they take an opportunity to think about what they've gone through in their lives and then admit, I have this issue and it's okay to have it. And then where do I go from here? And that's where different agencies and organizations that were mentioned before are trying to create environments where it's okay to seek those resources and to seek that support. So where our organizations are trying to become more trauma informed and to be responsive to the needs of the community, allow yourself grace in admitting when you have something wrong. It's okay to say, look, even if it's at work, I can't meet this deadline. Be open and honest about it. So even if it's a little small step to even admit that. But I would say just making sure that we all take some time to educate ourselves on what is it that we're so afraid of when we go to admit that something is wrong as adults. And then for our team, our teens do a great job expressing themselves. Listening to Gracie and Zana, you didn't need us here at all. They could have led this whole session and we did not need to be here. So I just want to also make sure I highlight these two amazing young people because it is not easy to jump on a call like this and be surrounded by a bunch of adults who think they know everything. So I want to make sure that I thank Zana and Gracie for sharing and being so open with how they're feeling and all the great work they're doing with their friends and with their communities to really bring attention to this. So thanks for having us.
Well, thank you, Christine. Before I close this out, I do want to ask panelists if you'd be so willing to put your emails into the chat so that any of our audience members can reach out to you with additional questions. If they want to seek out resources you might have, or if they want to seek out opportunities to collaborate, please put your email in. We can copy those down. But as you do that, I want to thank each and every one of your time, sharing your experiences and your wisdom. I hope that our audience members learned a lot or clarified your positions. I hope that the calls to action were heard, and I'm certain that at least amongst our panelists, these words will become action. I just ask that our listeners also do the same thing. I want to thank School of Medicine and Georgia Seal for our partner in this process, along with the HealthWorks initiative. I want to thank the folks at the Black Cross for helping us put on this fantastic town hall. And I want to thank everyone who has been listening for the last hour and 9 minutes for your time. I think we are all on the same page in believing that the mental well-being and health of our youth is something that is important and something. But with that, I will say thank you again to everyone for your time, and I hope you have a fantastic evening and rest of the week.